bb2121 is a CAR T product directed at BCMA. It uses a 4-1BB costimulatory domain, and it's for patients with relapsed refractory multiple myeloma. So we're presenting the completion of the phase 1 dose escalation portion of the trial. We have started the dose expansion, but we're not presenting that data just yet. So 24 patients were collected, 21 patients were actually infused with the CAR T cells, so only 3 patients actually deteriorated. This is a patient population that is very heavily pretreated with 7 median prior lines of therapy. So they had basically exhausted all of their treatments. So actually it's quite impressive that only 3 patients were not able to move through. Of the 21 patients that did move through, they were enrolled on a subsequent escalation of doses starting at 50 million CAR T cells, 150, 450, 800. We actually were planning to go up to 1200, but we did not go up to the 1200 dose. These patients, the dose escalation completed. In terms of all patients were accessible for toxicity and response. The cells were, to our surprise, actually quite well tolerated. The 2 toxicities that we worry the most with CAR Ts, especially presented in other studies, are cytokine release syndrome as well as neurotoxicity. As expected, 71% of our patients had cytokine release syndrome, but they were all grade 1 and 2. Very few patients had grade 3 CRS, and these were all reversible within 24 hours after 1 dose of tocilizumab. We had, I don't recall the actual percentage, but we had a few patients that did have neurotoxicity. Again, it was grade 1, 2. We had no grade 3, 4 or higher. 1 patient required steroids as part of the grade 3 CRS that was ongoing as well, and all of it was reversible. There were no on-study deaths. In terms of the response, we saw in the 21 patients, the first dose level was subtherapeutic, so all those 3 patients had a very transient response and progressed very quickly. After that, at the 150 and above, all patients but 1 had a response that had been very durable. So our overall response in the patients treated at the therapeutic dose levels is 94%, with 56% complete remissions. If you look at compare that with the data that we presented at ASCO, at that time we had 27% complete response rates, and now we have a 56% complete response rate. So what tells us is if we look at there's a swimmer's plot that we're presenting, and you can see that the responses continue to improve with time. Actually, as far out as 15 months out did we see a patient convert to complete remission. So this therapy is working so quickly that it's actually it's inducing a little bit of a complex assessment in myeloma, because we're seeing that the tumor cells are killed, but then the paraprotein that is required to become negative is lagging behind. So we're starting to see something that we never seen before, which is actually MRD negativity in patients that are even in partial remission. And so in the 10 patients that were assessed for MRD, 9 of those 10 were MRD negative. So far we haven't reached our median progression-free survival. It's a median follow-up of 40 weeks, and we haven't reached the median progression-free survival. At 6 months, 81% of patients remain progression-free.